Good afternoon, good morning, dear colleagues, and welcome to the first session of the online series of the ENISA eHealth Security Conference. That conference is organized for the first time virtually to accommodate the traveling restrictions that we all have and to be able to welcome even more our audience, even more experts to participate with us in these difficult circumstances. Thank you for being here with us. The conference today is organized together with the Danish Health Data Authority, and I am Dimitra Liveri. I am a network and information security expert in ENISA, and I will be the moderator and the host for the discussion today. Before starting with presenting our esteemed speakers, I would like to give you some housekeeping rules so that this 2-hour session will run smoothly. So the virtual discussion is broadcasted in the ENISA YouTube channel, and you are kindly invited to share your views and to pose your questions to the panelists and the keynote speaker using the chat, the live chat, and the comments that you see there in the channel. Please kindly note that we will be moderating the questions, and any inappropriate comments or insulting comments will be automatically eliminated. The ultimate goal of this 2-hour session is to bring the community even closer together, even though we cannot meet at these peculiar circumstances. And we would like this session to be as much interactive as possible. So we urge you to join your views, and we kindly invite you to the discussion. Please note that this is the first of the 3 occurrences that will cover the whole 6th eHealth Cybersecurity Conference. These will take place in weekly occurrences. So the first one is on the 23rd of September today. The second will take place on the 23rd of October, and the last one will take place on the 23rd of November, all at the same time at 2 a.m. Central European Time. And more information regarding the upcoming events you will be able to get by visiting the ENISA website. But without further ado, I would like to stop sharing and introduce to you our esteemed speakers and panelists. So first of all, I would like to introduce our collaborator from the Danish Health Data Authority, Mrs. Krista Wolf-Scharbis, is an expert in cybersecurity in the agency, in the Danish Authority, and has been our counterpart for the whole journey of organizing this online series. So thanks a lot, Krista. We hope that one day we will be able to meet in Copenhagen or in Denmark and to have these meetings physically. I would like to introduce to you our entire panel, all the speakers that are participating here today. Firstly, our keynote speaker, Ms. Vibeke van der Sprong. She's the Deputy Director General of the Health Data Authority, and she's a chairwoman of the steering committee responsible for implementing the cyber and information security strategy for healthcare in Denmark. Welcome, Vibeke.
Thank you. Hi.
We have also with us Albert Haroabad. He is a Chief Information Security Officer in the Cybersecurity Agency of Catalonia for the public healthcare in Catalonia. Hello, Albert. Welcome. Hello.
Hello.
Now we hear. Thanks a lot for joining. We also have with us in our colleague, Dr. Sabina Magalini. She's a senior surgeon at the Policlinico University Hospital and assistant professor at the UNICAT in Italy. And she's talking to us live from the hospital. Hi, Sabina, welcome. And last but not least, we have the Chief Information Officer of the Bulokva Hospital in Czech Republic, Mr. Martin Konner. Welcome, Martin.
Hello.
Hello, welcome. Thank you all for being here with us. We have a pretty tight agenda to follow, so I would suggest to start without any other delay. So, Vibeke, the floor is yours. Let me just put your, these are your slides. Let me just share them, and we are set to go.
Perfect. Thank you, Dimitra, and thanks for inviting me to speak about this topic, which we all share: cybersecurity in healthcare in times of pandemic. I'm very pleased to be here, and I hope that some of the experience we have discovered in Denmark can be participating into a good discussion further on. Dimitri, please go to the next slide. I have a brief agenda. I will talk about it. I will describe a little bit about the Danish Health Data Authority so you know from which organization I come from, where Krista comes from, and what we are doing, and how we are collaborating with the other parts of the Danish health sector. Then I will go on to talk about cyber and information security in the Danish health sector, and within that I will describe how we have digitalized the healthcare sector in the last 20 years in Denmark, not in details for sure, but the cornerstones of our digitalization, and how we within that have worked with cyber and information security. Then I will go on and talk about the consequence of the pandemic and how we have responded to that, how we have participated into how we have a high degree of testing, high degree of handling the COVID-19 crisis. And I will conclude with a little recipe, what we call the Danish recipe, but hope that it will be we can bake a cake together with others from other countries. I think we all need to share our experience and good ideas about how we have been through and how we are getting through right now the COVID-19 crisis. Yeah, I will go on. First, a little bit about who we are. We are agency. We have been established in 2015. We are a part of the Ministry of Health, so we are part of the state. We have three tasks. We create national data about healthcare. We create digital solution for healthcare, and we create national cybersecurity in healthcare sector. Then we have a fourth task, which is that we do also make IT support for all health authorities under the ministry. We are around 300 employees. We are organized in 9 departments. One department is the cybersecurity department, where Krista comes from, and where Søren Birk Greenfeldt is the head of department. We are a mixed group of employees, young people, older people, my age, all together. We are IT people, academics, health professional, pharmaceutic, office employees, and many others. We have a nearly 50-50 gender distribution. We are 60% women and 40% men. And we are then located in Copenhagen, actually in an old military area where my great-grandfather was a young soldier under the First World War, where the houses were for the soldiers and for their horses. So it's a little bit funny to be in those old environment. And at that time, you also had a crisis, and after the First World War, you have the Spanish flu as well. So there's a little bit of connection that way. That was enough about us. I think we can go through. We have some core tasks in the Danish Health Data Authorities. Our main task is to produce current health data and digital solutions that benefit patients and practitioners. That's the one we are working for, plus research and administrative proposals in the health sector. So we have a service to all the whole sector, and we try to contribute into the tasks they're doing in hospitals, in the municipalities, in at the doctors, protections, and so on. So we are trying to having, of course, we have some core tasks for ourselves, but we also for sure are the one who is creating a platform, both digital, but also with data and with cybersecurity, so the whole sector as a whole can produce as well as possible. And that also means that we have a task in turning political objectives into concrete solutions. That can be data, it can be cybersecurity, and it can be digital solutions. Now, enough about us. We can go on to the next slide, which where we have the two other slides was still about the normal situation, what we are doing in normal days, and then we have had in the last half year and a little bit more some other tasks during COVID-19. The things we have been involved in is has been very much to produce statistics on COVID-19, both on infected, hospitalized, and deceased. We do it on daily basis. We are the one who is creating a dashboard to the Prime Minister and all other sectors to make sure that they know for sure how have the numbers and the infected people how that had developed since yesterday. We are also what we can call the research machine for the National Agency for Vaccination and Infections, who is together with our Agency for Health are working hard on the more clinical part of the of fighting COVID-19. And then we are providing researchers with data so they can modeling and prognosis for COVID-19, and that have been a huge demand for that in the last year. So we are really trying to catch up with that. We have made automatic solution on what we call the National Service Platform for Healthcare. That is a platform which provide a lot of our digital solutions, and we have developed that. We have been a part of the COVID-19 tracker application, the little app, which around 1 million people have downloaded. We are a population of 6 million in Denmark, so 1 million is quite all right with us. And then we have been participating in developing existing digital solution to COVID-19 task. One example is the booking system. I will talk about that a little bit later. And then we are supporting our testing center. We have testing center all over the country, as you have as well. We have an organization with infection detection, and all those operations have to be on a digital platform. So we are supporting that as well. Yeah, that was our main goal. I will go on and talk a little bit about how we work with cyber and information security in the Danish health sector. But before that, I will describe a little bit how we have worked with digitalization in Denmark and the cornerstone in that digitalization. We have more than 20 years of digitalization in Danish healthcare, as well as you have. And what we have seen is that the efforts we have done in the last 20 years have really provided us with a digital platform, so we were able to build the COVID-19 efforts, digital efforts on that. we discovered that we had a platform which we could build our new system on. That was the booking system. It was also the app where we could show the test result each time a person in Denmark go for a test of COVID-19. How do we we had a application which were developed and which meant that we could get the laboratory test result into that application as normal, instead of creating a new kind of application. So having those digital platform and have them ready have really been our luck in many ways, and our benefit that we could handle the COVID-19 in peace. We have those solution made in peacetime, and we can then handle the crisis of COVID-19. And what we have seen is that because we have done the digital platforms in normal times, we have for sure made them ready with cyber and for information security, and where the experience we have as well is that building a digital solution in a rush, as you are when you are in a corona crisis, that can have an impact on filling sufficient security. But we have, but because of building upon the existing platforms, we have in many ways been able to fulfill our security conditions. If you see on the figure, then we have some cornerstones which I like to put a little bit few words on. One element of our digitalization is that we are many operators in Denmark. Dimitri, maybe you can show me the next slide, and then we go back to this one. We have the Ministry of Health. We have 98 municipalities. They are having the responsibility of care for elderly, and they have the responsibility for the preventive task. We have 5 regions in Denmark. They are responsible for the hospitals. We have around 60 public hospitals and 19 private hospitals in Denmark. And then we have all the private sector with the practitioners, doctors, pharmacists, dentists, specialist doctors, physiotherapists, and others. So we are many operators, and that of course give a more complex environment in creating both digitalization but also cyber information security. But one of the other cornerstones, and then you're very welcome to go back to the next one, not to the next one, to the former one, please, is that the many operation means that we get a quite complex IT environment because we all build digital solutions. The municipalities built digital solution. We built the region build. But we all do it in a collaboration, which means that we in many ways have a quite integrated digital and both infrastructure but also environment and setup, which give clear benefits instead of that it was a very centralized digitalization. It also means that we are closed in our collaboration. We are close both formally. We have years. Every year we made a yearly agreement between the government and between the other partners about what common digitalization are we going to work with. And we having steering committee for all our projects that way. But also informally, we are working close together. I started this morning with a virtual coffee meeting with the other partners, where we don't really have an agenda, but where we can get together and sharing and talking about topics which might not really be going on the formal agenda, but is needed to be fixed. And that environment in our digitalization have continued in our way of working with cyber information security as well, and that I would like to show on the next slide. Yeah, that one. Back in 2017, we started the government started making the first for us Danish cyber information security strategy. It was the cross-sectoral national strategy, and in that strategy was based both on our national demand. We for sure. It was not a matter of that we didn't work on security and cyber information security before, but we didn't have a common national strategy before. And in that strategy, we pointed out the critical sector, very often it's energy, it's finance, it's telecom, it's maritime transport, but it was also healthcare. Healthcare was from the beginning pointed out as one of the most critical sectors in Denmark, and one of the sectors where there had to be a special attention. For all those sectors, now please wait. I like you. For all those sectors, we were created a D6, which is a central unit for cyber information security in each sector. So the healthcare has its own D6. The first thing we did after the national strategy was to make a national health sector strategy, which we did in 2018 as well, and it has the timeline 2019 to 2022. So we are right in the middle of that strategy. It contained 22 concrete initiatives, and we are working very hard with fulfilling all of them. And that is one of Krista's main tasks to make sure that we all are bounded and pay all the attention to those initiatives. We also have a steering committee where we have all the partners, which I listed before: region, municipalities, doctors, and also the Center for Cybersecurity in Denmark around the table. And we are, as a steering committee, we are responsible for implementing this security strategy for the health sector in Denmark. And then, yeah, we have the office of the DCIX. So this is our framework, and the framework we looked into when we enter spring this year. And now we can go on to the next slide. As you probably have experienced as well, the attacks related to coronavirus have increased enormous. We have figures around 500,000. That's worldwide for all sectors. And one of the reasons for that is for sure that we are all working at home, and the security for working at home might not always have the same boundaries that we see when we are at the office. However, the numbers are interesting. The increase is very interesting as well. But I will share with you a few of the attacks we have discovered in Denmark. Now you can go on to the next one. Yeah, we have some examples. We had an attack. We start with ourselves. We actually have a very recent attack of phishing at the on the Danish Health Data sites and the Agency for Vaccination and Infection. We most of our attempts are caught, but we also see the criminals are searching for new ways of attack, and this was a new one. The good thing was that because of the awareness we have been giving and been talking about for the last years, it only compromised 28 of 250 employees. And that was mainly because one of the 28 were quick in responding that this can't be sure, this have to be something false about this, and instead of going on with their own work, then quickly responded to our IT support, so we could shut it down very quickly. We see phishing attacks on, especially on our Danish identity and digital signature solution called NemID. All of us from we are 15 years old, have a NemID with our digital identity and signature. And there's a lot of attacks on that. They are sending text messages to citizens asking for login details, and in many ways often succeed. We see that a lot, and we have seen that further on in the last months. Then there have been examples of typo quoting. We have, together with the Center of Cybersecurity and the telecom sector, we have closed down a lot of websites which have described themselves as being from the healthcare sector, and that way are trying to false and treat citizens to give in information. Then we had a ransomware attack. That was to a private company, Amgros, which are a big international service supplier. Through one of those of their suppliers, they got attacked of ransomware. And the good thing for us was that it didn't develop into the healthcare sector, but it meant that our hospital pharmacies were not able to use the portal, the web portal, for a week. So it really shut down the business of Amgros for a whole week, and that way it also has an impact on our healthcare sector, not in a cybersecurity way that we were infected, but that we have to that we couldn't be customers in the same ways as we normally were. So that was some of the attacks we have been through in the last couple of months. I would say that it have been all attacks which have been able to handle. That's a good thing. So until now, we haven't had an attack which really shut down the whole healthcare sector or part of the healthcare sector in a way that we couldn't go through it and get it ordered. One of the things we are using in that handling is that we, and now you can show me the next slide, is that the Danish Consumer Council have made a little app which have been downloaded. A lot of people have downloaded that little map, and where we can provide with information about false website, false mails, and so on. So we provide it with information, and one information, as you can see here, is that we say there's a lot of false text messages about corona testing around, and it's looked like this. And when you look closely at it, you can see it looks like our website, but it's not really. And that way we have a channels where we can get those information out to the citizens So we avoid that too many people are getting into the websites, but are sure about, okay, this is a place where I should stay away. I should use the official one. Yeah, I think you can go on. I will, but altogether, the consequence of the pandemic is that we have had to ask ourselves two questions. The cyber threat has increased in Denmark and probably also in your countries. The Center of Cybersecurity saying now that the threat from cybercrime is very high to the healthcare sector. The threat from cyber espionage is very high to healthcare sector. And of course, we had to ask ourselves: are we then robust enough? Are we able to handle the increased pressure? Until now, we have been, and a part of that have been that we are using existing digital platforms and solution, and we have built in cybersecurity, information security in those solution in good time. But another issue for us have been that there have been increased need for new digital platforms and IT tools. As example, there's the whole automation of corona test letters. In the beginning, the authorities sent it out manual letters to a citizen about come and have a test. Now it's all been in a process of automation. The test replies, the test results are going through existing app. The booking portal is also an existing platform, and it means that we are using those platforms both in the same way, but also in a different way, and it has not just been a matter of taking an existing platform and then use it for corona, but it have been a part of that, but it also there have been new questions about GDPR. There have been new questions about how to ensure the information, how to make sure that the cyber security and information security defense are enough in handling those tools. One of the new things we have built, which we didn't have at that time, was the COVID-19 mobile app, which will be one of the topics for one of the upcoming conference. But our questions have been: how can we use an already existing solution, and how can we make sure that they are safe in the new proposal? One thing is that they are safe in the old proposal, but how do we work with it? And that have been a rush. In that way that we have had something to be standing on, but at the same time there have been new issues we had to figure out. So altogether, I would like to conclude with what we call the Danish recipe. You can go on. One of the what we have been standing on is that we already had established trust based on collaboration across our partners in the wealth sector. We knew each other. We had steering meeting. We have a formal meeting. We have informal meetings, and we had a digital environment which we could build on. Then there have been we have been really pushing out more awareness, focus both to citizen and all employees in the healthcare sectors. One thing is that they had awareness before, but we really have, together with our partners, pushed out that awareness so to a higher degree. So I see a higher matureness in how to handle cyber and information technology in daily life and in daily task. We have a sector-specific strategy for cyber information security, which gave us a good background for that. We collaborate with all the 6 other critical sectors. A lot of the attacks goes not just to the healthcare sectors, but to many of the other sectors. We have collaboration internationally. And then we have focused very much in our own organization to internal collaboration and knowledge sharing within the organization. And then I must say, until now, we also had a little pinch of luck, and we do hope that that luck will continue as well. I would say thank you. I hope you have got a little insight about how we are working with cyber information technology, both in normal times, but also in the times of pandemic. Thank you.
Thank you so much, Vibeke. Thank you very much. I think we are back all together. Yes. Thank you so much for the great presentation and for sharing with us your experience and what was the situation during the crisis, the COVID-19 crisis in Denmark. I have received some questions while you were doing the presentation, which I think we can actually share with the whole panel. However, one of them I would like to share with you, Vibeke, directly. So a colleague from the audience says that COVID-19 has definitely resulted in an increase of attacks. Are there specific legislative efforts that are being made? I don't know if the COVID-19 tracing up can be part of it, but is there a legislative procedure that is taking place at the time in Denmark?
Not specific to the cyber and information security. We have made a lot of new legislation to handle the COVID-19 crisis, but not specific on the cyber and information security. However, we are actually there's two things going on as well right now. One is that the national strategy for cybersecurity is going to be a new strategy. It's will finish this year. So we are working with others about the new national strategy. So, and in that way, the experience of the COVID-19 times have for sure made a pressure on how we are handling with cyber and information security, both in our own sector but also in other sectors. Then I would say that we are also working very hard about getting through some of the initiatives we are working with, especially analyzing center of surveillance all attacks in the healthcare sector. So there have not been extra on further legislation, but there have been some initiatives which for sure have had an impact, where the COVID-19 have had an impact on how we are dealing with it today, compared to how we would have dealt with it if we didn't have been through the crisis.
Thank you so much for the reply. I think that indeed the crisis makes us eventually wiser, unfortunately, and possibly stronger. Thank you so much, Vibeke, for the great keynote. Thank you for opening the series of these online events. I would like to now go on with the panel participants, the panelists, and I would like to kindly ask you one by one to give a brief introduction of yourself, of the organization you are part of, and of the related activities to cybersecurity in healthcare. Firstly, I would like to start with Albert. I will go alphabetically. So, Albert, please, the floor is yours. The mic.
Thank you very much. Good afternoon. I am very happy to be with you today. I'm Albert Aro, Chief Information Security Officer in the Cybersecurity Agency of Catalonia for Public Healthcare. Thanks a lot to ENISA for the invitation today, especially to Dimitra and to the eHealth team that has been leading the eHealth working group so well during these days. And also thanks to the Danish Health Data Authority. It's an honor to be here today and to share with you our experience and my thoughts about the challenging situation we are living today. 1 year ago, when we met in Barcelona during the 5th Security Health Conference organized by ENISA in November 2019, it would have been impossible to imagine what is going to happen, but what's going to happen during this last month. However, in these difficult times, I would like to highlight the enormous collaboration among us to face this problem. I believe that we can learn a lot from what has happened with COVID-19 pandemic. In spite of the excellent healthcare system we had in Europe, we had seen that this system had been totally overloaded in many countries. The demands were excessive for the capabilities of the system, and the system had to protect itself. Several countries were forced to lock down the access to avoid the collapse of the system. In security, we have a similar problems and solutions to solve them. To fight COVID-19, we are using face masks to control the spread of the virus. In cybersecurity, we have to deploy preventive measures to reduce the surface of exposition. To fight COVID-19, we perform tests to detect the virus. In cybersecurity, we need to implement detection systems. To fight COVID-19, we need to implement treatments in cybersecurity. We need to be prepared to reduce the impact of the incidents. I am not sure we have a cybersecurity system in Europe as mature to face cybersecurity risk as it was our health system to face pandemic. However, I definitely think we are doing steps in that direction. Our main functions as a cybersecurity agency is the prevention, detection, and response to the growing cyber threats and risk of the digital ecosystem. We have to offer a cybersecurity public service that protects citizens, companies, and institutions from the increasing cyber threats we're facing as society, and also the information systems that assist in providing healthcare. In the area of health, we work together with the Catalan Health Department, CatSalut, and the main stakeholders in order to deploy a cybersecurity model that ensures the protection of the main assets of the public healthcare in Catalonia. Of course, the most important asset is people, patients, as well as health professionals, but also the protection of information and the correct operation of technology services. The National Health Service in Catalonia is governed by the Department of Health that establishes the health plan and the CatSalut that contracts the healthcare services to a very rich and diverse group of healthcare organizations, including public institutions as well as private centers. And we work together in order to create a network of security professionals and technology that ensures cybersecurity protection and governance. Collaboration is essential in the world we are living. We look forward every day to give cybersecurity value to the health ecosystem, but also to empower the organizations to manage cybersecurity risk. During this time of COVID, information technology services are being strategic and the collaboration work is intense in order to give solutions to the unforeseen needs. Remote work and telemedicine has emerged fiercely, and they have come to remain because they have brought a lot of efficiency and often fastest time of response to the demands of patients. Also, new ways of communication with citizens, such as the APP Stop COVID we developed, that have been used for self-diagnosis and control of the pandemic, and which has been developed in only 48 hours. On the other hand, the surface exposed have grown exponentially, bringing new risks to be managed. Cloud solutions have provided elasticity and fast access to new services, but has also brought challenges to deploy the cybersecurity perimeter. However, cybersecurity does only help to reduce risk. It brings also trust and confidence in the services and institutions. Regarding cybersecurity risk, phishing remains the main vector of attacks detected in the healthcare sector to its effectiveness and simplicity. Even if we keep improving the preventive protections that block a high number of malicious emails received, there will be always some phishing emails that arrive into the mailbox. We have seen a lot of phishing using COVID theme or pretending to be healthy entity. The healthcare sector is a constant target of phishing attacks that we still have an important challenge in this area to improve the awareness of the healthcare professionals. We have seen this month to what levels healthcare professionals are committed with society. However, healthcare professionals are still too vulnerable to phishing, and we need more training about how to react in front of a cybersecurity incident. We work with stakeholders to provide them with targeted contents, and we try to bring our grandest up to improve awareness and resilience. Regarding threats with high impact, we are facing more targeted, advanced, and persistent threats than even before. WannaCry, that caused serious incidents 3 years ago, is a prehistoric threat now. We have seen a significant increase of the number of this type of cybersecurity incidents, and this time of COVID hasn't been an exception to this progression. The incident can start with a steal of a credential or with the exploitation of a vulnerability. The criminal takes the time to analyze the environment. Only when he knows he can do a lot of harm, he deploys the ransomware. Recently, we have seen the threat includes blackmail to publish confidential information. As a summary, we are living an intense period of time and hopefully creating a new and better world. Thank you so much again for the invitation. Thank you.
Thank you, Albert. Thank you so much for the introduction. There are some questions that I think are very related to the topics that you touched upon. So regarding awareness raising in the healthcare employees, and also questions regarding the cybersecurity requirements for procurement for departments in hospitals. But I would like first to conclude with a round of introduction from all the panelists, and then we will go into the questions. So next is Martin. Martin, would you like to introduce yourself and your activities to the audience? Thank you.
Hi, everybody. My name is Martin Konisz. I work as a Chief Information Officer in one of the bigger Czech hospitals. I thank Dimitra and ENISA for being part of this panel. I think this might be very interesting for us panelists and also everybody who might be looking at this. My former experience is as an enterprise architect and solution architect from a financial sector. And now I'm trying to help in Czech healthcare by being information officer in one of the bigger hospitals. I think for the introduction, that's all. And we are a bit late in time, so I will cut it this short.
Thank you so much, Martin. Thank you. I think you have very interesting experiences to share. So you have a lot of, we will give you a lot of time to speak, also to share what happened in the hospital in Bulovka. And last but not least, Sabina Magalin, please share with us, introduce yourself and the hospital and your activities around cybersecurity. Thank you for being here.
Good afternoon. I'm a doctor, so as Dimitra was saying, last but not least, I am the end user, let's say, of all this system. I am an emergency surgeon, and now I'm 60 years old. That means that I'm very old. And so I like dealing with framework problems. Cybersecurity has always been an interest. And fortunately, 2 years ago, we won a European project with the name of Panacea, where we are designing some tools to help hospitals with cybersecurity issues. So it's let's say, a grassroots approach. Naturally, on top of this project, in the middle, we have the COVID crisis. So all the vulnerabilities the hospitals had are coming out even more than before. Naturally, I heard what Vibeke said from Denmark. You have to consider that Italy is maybe 15 times Denmark as a population, hospitals, and we are a big, chaotic system. Maybe Albert from Spain can understand what we're talking about. So in this, and we also have a less, let's say, maturity towards cybersecurity than I think some other European nations, even though we're pretty well along. So during the COVID crisis, what do you want to know it now, or is it sufficient that I work in this big room, we're 104 1,400 beds, and we are a major hospital also for COVID response in Rome. We are the biggest one who is doing the admittance of the problems of the patients. So I can answer the questions later.
I think we can directly address some questions to the panel just to start the discussion going. I would like to ask all of you, starting now with Sabine, that what is your experience from the COVID-19 crisis in the hospitals? Did you experience any cyber attack? And I will try to combine also some of the questions that I have received from the audience. Which were the steps that you took towards tackling the issue? Is there an average time to detect or to respond? Maybe is there has this increased or decreased now during the crisis? And what are the efforts made overall to try to make more resilient the hospital and the institution overall? So Sabina, the floor is yours.
So cyber attacks, we did not have anything significant except the things that you usually have. You usually have like phishing attempts and this. So this we were lucky, and the Shamrock is also for us, fortunately. What is one of the main worries is that we have changed the way we work, basically, because operators have you go to a door, you know, with the handle if you want to be, especially in the high, you know, infectious departments. So in one way, the thing that I've always said that we need some kind of identity management in hospitals that is a little bit more efficient than identity and password is even more you know, important now. Like if we had an identity management system that recognizes our face and makes us go through doors, that would be very helpful. Naturally, a hospital is not a nuclear power plant, so you cannot expect that kind of biometrics or whatever, but that we need to upgrade the system to something more simpler for identity management of operators is one big problem. Another big problem is that we change the way we are working because we're doing a lot of smart working now. So all the people that are at risk or working in offices or that can do the staff work from home are being incited as you stay home and do smart working from home. Now, smart working is different from teleworking. You can teach me. So all the problems that are coming out from this, naturally, the hospital has to address them, also because of the many thousands of VPNs that we're opening. So the solutions that we had to create to face this problem. Another problem is that hospitals are ordering like crazy. You know, I don't know if you know all the fact that we don't have the masks, you don't have the PPEs, so we're all the drugs. We are ordering a lot more, and this excess of order exposes us to looting. Now, naturally, it has not happened in my hospital, but in Italy, there were many cases where the orders have been paid and the things did not arrive because the payments have been made on, you know, fake suppliers. These are just some of the problems we have.
Thank you so much. Martin, any cyber attack that you experienced in your hospital, and how did you handle it? How did you tackle the issue? How did you maintain so that the impact wouldn't cascade?
Well, in the April this year, just in the rise of the first wave of the COVID crisis in Europe, Czech Republic was under a heavy attack. The Czech hospitals were under heavy attack. Our National Security Agency has given us warning regarding these attacks, so we had some time to prepare, and hopefully these attacks were not successful in this wave. But there are hospitals in Czech Republic who in the last year have been attacked successfully. There are hospitals who were unable to do anything for a month. There are hospitals bigger who have been unable to do anything for a week. And so this threat is pretty real. And that our security bureau and intelligence agencies were able to warn us that there is a big attack coming during the April was pretty good. But as it is from my experience in cybersecurity anywhere, you have to be prepared all the time, as the immunity system of human bodies also prepared to fight the germs all the time. Then also your systems in the hospital must be ready all the time to defend.
Thank you so much, Martin. I think actually you raised some very interesting points regarding warning and information sharing and collaboration. So I will go back to the authorities, colleagues that are participating here in the panel. So Albert and Krista, if you want to join us also, and Vibeke, what Vivek already shared, and she gave us a view of what was the situation. Also, did Albert more or less on cyber attacks in the sector and on specific cases. How did from legislative / policy perspective the authorities support this whole effort, and how would eventually collaboration and this kind of any type of system for sharing information like early warning or sharing best practices, what were the approaches that you took, and what do you think was eventually how did it help the sector to protect? Albert?
Sure. Regarding the legislative situation, we have the NIS directive, which has been transposed in all the countries in Europe and in Spain too. It has a specific law that has been transposed. There is also a health plan that has been developed by the state. So it defines the way we have to work with cybersecurity incidents in the health care, because as you know, the health care centers are considered as an essential service in the NIS directive. So we work together with the CCRs in the state, and we communicate the information when there is an incident. In our role in Catalonia, it's to deploy our services, and we when we identify a vulnerability or a situation of risk, we have established a channel to alert all the health care centers, and we send always early warnings, and we have been doing this from maybe 2 or 3 years ago, and we have had a very good feedback. Something you asked before, it's the time it takes from the moment there is one attack and the moment that it has been detected? Well, it depends. Of course, we have attacks that we detect immediately, but the type of attacks that worries us more is the ones that are looking to do a lot of harm, and it can take days, weeks, and months, even from the moment there is an insider, an attack has reached the insider of an organization and the moment he launches the attack. So it can take a lot of time, and it is important to have security measures in order to detect monitoring the flows and everything to detect the attack before he launches the ransomware.
Thank you so much, Albert. And going back to Vibeke maybe, so is collaboration an important tool to increase cybersecurity in the sector? And would this kind of sharing of information eventually work for the healthcare sector?
I would say that this is our experience that the collaboration is crucial for warnings and for handling the attacks. That for sure. I think I will give saying that I will give the question further on to Krista, because then you can get more detailed, concrete information and examples about how we are work with our sharing communication about warnings and attacks.
Thank you, Vibeke.
Yeah.
Yes, there are so many ways we collaborate every single day, and I think also Vibeke has already shared a lot of them on how we collaborate. But I also think, for example, one thing we do, and which we actually do very, very soon, is that we have an emergency exercise. And we do that together with Center for Cybersecurity and also together with our actors. So instead of, just waiting for things to happen, we actually exercise what do we do, what are our roles, and also, of course, we take back after the exercise, we take back the learnings and maybe change, what can be better. Also, when we have small emergencies, we also, every time we have a small emergency, we also learn from that. So for us, it's very important to collaborate across the actors every single day and really have a good relationship with them. So we're really trying to build a nice relationship, and we spend a lot of time working together with them, sharing information in all kinds of ways, both with knowledge groups, but also more technical groups, and they're actually also involved in the work we do in the projects, in the strategy. So and we also work very closely with the vendors, which is also very important. So yes, we think it's really, really important to collaborate both internally in Denmark, but also internationally.
Thank you so much, Krista. I would like to take some questions also from the audience, from the live streaming. Somebody asked, how did you approach awareness raising of healthcare employees and citizens? So I see Sabina saying that, okay, no matter how much we educate, the human will always be the weakest link, and probably during the you cannot perform trainings and awareness raising campaigns during a crisis, but overall, maybe as a last resort, maybe something did work. So what is your experience? How did you approach awareness raising for the physicians and the professionals in the hospital? Should I start? Who'd like to start? Should I start with Sabina?
Well, one thing that's important is that, in a way, also from the lay press, there was a lot of information of cyber attacks. I mean, there has not been, in our case, a specific campaign done inside the hospital, except that we are offering like a very light cyber training through, you know, the workstations and when you log in during the day, etc. But people have realized that there are cyber attacks. The problem, one of the problems, which I don't know if it's only Italian or maybe it's in the rest of Europe, is that there is a lot of underreporting. You know, even if you do have an attack in a hospital, something small or a phishing attack that goes well, there is not so much reporting to the authorities because this is not enforced in a way. And also there is on the side of the hospital a lot of fear of sanctions, you know, of losing data and this and that. So from the national authorities in Italy, we have the postal police, which is something of the Ministry of the Interior that does give us some awareness of, you know, there are new cyber attacks around, look, take care of this and this and this. Usually this goes to the top management of the IT system in a healthcare structure. But from there to the people who are actually working, there is like a gap of information. Not always we do get the information. So that is one of the problems, is that the information does not get down to the operators effectively. And also another problem is that there's a lot of new healthcare staff. You know, with this crisis, we have hired residents in their last year of training, a lot of people, you know, to do the work. And naturally, when you hire people in a crisis, there's all the problems of the profile management. People change where they're working, so the profiles are different. Some of the profiles do not get closed, and so you have all these open profiles. Now, naturally, I don't want to talk about all the problems because it seems that we have all the problems here, but these are everyday cybersecurity issues.
Thank you so much, Sabina. Thank you. Yes, Martin, the floor is yours.
We have a bit of an set advantage in Czech Republic. As I said, some hospitals were attacked successfully. Some hospitals were not operating for a huge amount of time. So our people are a bit aware. They're afraid. That's something which is helping because when they're afraid, they are more cautious. And just because this thing that happened, I was even unable to enact some harsh measures on our employees. For example, we enforce security training, and without successfully doing some tests in the end of the security training, they are not allowed to access internet. They are allowed only to go to the inner systems and stuff like that. So in the last year, we have moved a lot because there is a big traction. Because now people are afraid because there have been big problems. So that's how we can. But I think that for what Sabina said, because we have so many new doctors, young doctors, then their awareness of the cyber threats is usually much bigger. I don't have so many problems with my users which are younger because they grown up with computers. They have phishing emails on their personal email addresses as well. So usually they know at least something. The biggest issue with our employees is with the older generation.
Thank you so much. That's a very interesting note to make. Albert, your views?
Yeah, sure. Well, it's an important issue because honestly, as I mentioned before, awareness raising, it's a very important issue, and there is still a challenge. And I understand very well what Sabina has explained before. I understand. Well, of course, we have plans for information, no, more traditional, but we have seen that it's very difficult because the agendas of the physicians and healthcare professionals are very tight, and so what we have seen that works very well is, for example, simulations. So we have done phishing simulations, and this can raise a lot of reaction from workers, and this is something that can arrive directly to everybody. And now we are working in something with a few healthcare institutions in order to develop small pieces of awareness and put it inside the information system that the doctor uses. No, and every day, not every day, but once a week or once from time to time, he will have an information directly from the information system it uses, no, for the medical assistance. Of course, it has to be something that is very specific. That it doesn't take more than 10 or 15 seconds because they really have a very tight agenda, and we are very anxious about seeing results, and we think that this could be a very interesting idea. When next time maybe we can show you the results of that.
So thank you so much, Albert. Just taking some a few questions also from the audience, and maybe this would be better. Yeah, you can decide who would like to take this over. To what extent are the responses to cyber attacks centralized by government or cybersecurity service? I would suppose that they mean to which is the role and which is the flow specifically when an incident occurs in a hospital. So do you need to inform the cybersecurity authority in your organization? How does it work in Italy? How does it work in the Czech Republic? How does it work in Spain and in Denmark? And what is exactly, which are the specific rules that each authority has, and how does the information work between each other? I would like to link this to a very interesting comment that Sabina made, that if there is no enforcement, if there is no law, then there is a fear of underreporting. So is this the case everywhere? Is this the case, for example, in Denmark? So what is the situation in each member state? Who would like to take first the floor? Vibeke, would you like to take the question? Thank you.
Yes, I can do so. I will start the question, and I'll start the answer, and then Krista will take over again. But I will say that this in Denmark we have the Agency of Data Security. We had within the GDPR detective, we have to report our data security attacks and leaks within 72 hours. And my impression is all, both in the healthcare sectors and as a whole in society, that leaks are reported into that agency. There have been very few penalties, kind of in case of where you had a fee to pay, even that is a tool they have. But so it had been more of a culture of that we need to report it to make sure that we know what kind of leaks we have. But and of course also when it has been very critical, there have been response on that leak and that handling of the leak. That is in general. And then in the other ways is how do we share the information with each other? That is actually more important because that's how you actually learn from how you are working and how you can develop your awareness and your way of working with the attacks and leaks. And I think Christian would be better to give some examples of that, how we do that.
Yes, thank you, Vibeke. First of all, for the hospitals, we have like a 24/7 emergency response team, and they can coordinate between the operators and also the centralized government agencies. So there is a process in place for the regions, and it is the region's responsibility. But at the same time, of course, we are connected, and also depending on the severity, because it depends on what's the case here. So we also have in our little unit, our thesis, we also have a phone you can call. We work very closely together with the Center for Cybersecurity, which is also an authority. And in that way, we have process in place, and people, well, I would say most people, most medical professionals, health professionals, they would know what to do, but we are also working on the awareness for what can they do and what can they do to prevent it. So kind of jumping into also a little about the awareness question, because of course we would like to help especially the doctors and the medical secretaries, and I think for us it's very important to know that their first task is to save lives, put it in black and white. So we have to be aware that they have a task towards the citizens. They have a really important task, and then we put the cyber hat on them and ask them to have like another very important task, because this is also Indian saving lives. So what we are working on and what we need to do is work with them, talk to them, because it's not about us telling them what to do, but we need to understand their world and their everyday work, and try to work with them and figure out how can we implement these kind of cyber tools in an easy way. So this is also a way of creating awareness, working with them and asking them, how do you think we can do this? Because you're already busy, you're already under pressure. So yeah, there is a big task in front of us according to awareness, but I think there is a process in place.
Thank you so much, Vibeke and Krista. I have Sabina, please.
Can I give a suggestion? What is lacking in the healthcare sector? Is it that somehow you're not considering the social technical system that we work in? Like, I mean, what you're saying now, saying, okay, we have to understand doctors, nurses, what they're doing, and not put a cyber shield on top of them. So in a way, if you analyze the way of working, then you understand better where the vulnerabilities are. For example, I'm not saying you have to do profiling, because that's not it's not nice to do it. But anyway, there's more risk linked maybe to someone who is inputting data than to someone who is, I don't know, putting on a monitor to a patient, which might also be a connected medical device, and you have already problems there. So in our project, Panacea, we have made a social technical systems map that if ENISA wants it, we can share it. It is one of the products of our project, because if you don't analyze the system, for example, the phishing campaigns, we have done them through our security office, but we were blocked by the sindacati, what do you call it?
The syndicate, the union.
The unions of the nurses, because when they saw in the phishing campaign where the let's say the the hook with which you tried to get the fish was something that they were going to have a prize on Christmas. Everyone clicked on this, and the unions looked, why did that guy get the mail for the prize and on Christmas and not I? So they made a big conflict of that, and we stopped the phishing campaign because it was not so popular. So you see, if you don't analyze the systems where you're going to enforce the awareness, enforce the cybersecurity rules, it's very difficult that you have success.
Sabina, just to go back also to the flow. So if an incident would take place, I saw that you said you discussed it a bit earlier, but if eventually an incident would take place in the hospital, what would be the flow that you would need to follow? Is there some kind of legislation that requires that responses to cyber attacks are centralized by governmental services?
There is a regulation that you should report, but basically it's up to you to analyze if that thing is sufficiently important to report it, okay? Sometimes you say, okay, this is a minor incident, let's not consider it. One other problem that we have is that we are, scared of losing healthcare data or not complying with GDPR institution. That is one of the big problems. So it's two problems. One is the cybersecurity, every day, and the other one is losing of patient data. So we put the things together in our mind, and in a way we dilute the awareness and the fact of reporting.
Thank you so much, Sabina. I would like to start combining some questions, if you don't mind, because in the chat there we have several questions popping up, and I don't know if we will be able to cover them all. Actually, this is a pretty interesting one. So you all more or less talked about the NS directive and how healthcare is considered an essential service for your member state, for your country. This is a situation for I think for all the sectors. Does it the European the NS directive require governments to fund cybersecurity investments in hospitals and in healthcare overall? I would actually start this question. I would directly pose it to Martin and to Sabina, because they are talking to us from the hospitals themselves. And then I would like to go to the authorities, so to Vibeke, Krista, and to Albert. So Martin, would you like to start?
Okay. For the question, does the directive require? It does.
Yeah.
And but well, the reality, I don't know a lot of how the health insurance system is done in all the countries. But for example, in Czech Republic, we have divided health insurance system and other public money. These are two different budgets in state-wise, and there is still the feeling amongst part of the government and doctors that cybersecurity is not something which should be paid out of health insurance, because health insurance is made for healing people, taking care of them, not for some IT stuff somewhere in the hospital, which I think is pretty bad because well, it's just normal overhead. You would pay electricity from the health insurance budget as well. You will pay all the other stuff like cleaning and other things. So you should also pay cybersecurity because you need it as a needed overhead for providing healthcare. So our government is trying to help us healthcare providers, but there is strong incentive not to do it from the healthcare insurance, but to get some donations or something like that. And for example, my problem in Prague is that Prague is considered one of the richest regions in European Union. So, for example, when we talk about European money, then Prague hospitals won't get access to them. But in our Czech system, Prague hospitals are in the same situation, regardless of the economic prosperity of the region, because we are public hospitals. We have the same funding as hospital in the smallest Czech city or smallest or poorest Czech region. And so it's pretty hard in this case. We should be paid from the normal budget. And in Prague, especially, we have very difficult access to European money for security, cybersecurity, and stuff like that. And so that's it.
Thank you. I have another question on what should Europe do. So I am marking you already replied there. So Sabina, please.
Look, before we started this project, I was not worried at all about insurance on healthcare data. I mean, doctors were worried if you do a boo-boo while you're doing surgery, okay, you're going to get a lawsuit. And we, until 2 years ago, we weren't even worried about this. Now, naturally, the fine is on the hospitals because basically you're losing the information. That is one of the main concerns. Insurance companies are not insuring hospitals for this kind of risk because they don't know how high this risk is. Inside, always, you always speak about Pasha, but inside our project, we have AON, which is a big insurance company. It is a consultancy for all of Europe, where they're practically studying what the risk for them would be. Because, if you're an insurance company, and you have a very high risk, what kind of a fee you have to put. So in a way, if you don't define the framework of the insurance, as Martin said, it's not inside the health insurance, because the health insurance is on having you pay for a cholecystectomy, but losing data, how do you define the damage? So it's one problem that, in a way, we have to face and identify a framework in which the insurance companies and the hospitals can move to do something better. One of the things they're worried about is when you don't have a correct governance. Let's say you have a hospital where you don't have a CISO, or you are not enforcing the correct cybersecurity rules, which I believe is true in over half of the hospitals in Europe. The insurance company naturally will not insure you. So if you behave according to the directives, then they will give you insurance for that. But at the moment, we don't have insurance for losing data. All the fine is on us, on hospitals, and sometimes doctors.
Thank you so much, Sabine. So I think now if we speak to the Danish colleagues, we will see a bit of a different approach, in the sense that I recall since 2 years ago, when we started discussing investments that the NIS would require eventually to be implemented, that some member states were already there. Some member states had already some budget reserved that would support eventually building up cybersecurity in the critical sectors, supporting the operators, the essential operators, so that they would eventually reach this cybersecurity preparedness level. So what is your view, Vibeke, on this? What is your
I would say that we have the fundings of the hospitals are made by tax payments. So we don't have an insurance system. We have a tax paying system. So it comes from, the tax goes into one money box, and then it is delivered to the regions and to the hospitals. And I would say that, of course, that create another situation for us, as it create a situation in a country where you are mainly financed by insurance. We I would say that today there is awareness or approach that digitalization is deeply integrated into your core task. If you made operation, if you made care, if you made whatever, then digitalization is not just something which a tool or something which are coming on top of it. It's something which is deeply integrated in what you are doing, and you can't do your task without the digitalization. So in that way, that approach help a little bit with the approach to cyber information technology, cyber and information security, that you see, okay, I need to protect that digitalization as well, both because if we get an attack, we can't work. If we have a data leak, we can't work either, and we lose our productions as well. So the approach have definitely changed. It doesn't mean that we have all the money we need to have for cyber and information security. We have got extra fundings for sure. The whole department in my organization, in our organization, is funded by new money. The regions have got fundings as well. However, we also have had to find fundings in our original budgets to create a higher degree of cyber and information security. So it's both new money, new investment, but at the same time also making other priorities in the budget you already had. And
Thank you, sir.
if Christian have a little bit extra information about the issue from the Danish perspective.
Is there something that you would like to add?
Well, I think actually you tell it really well. So also for us, it's also a question of working with the NIST directive and working them into the strategy, which we also do. So we are very aware of that. So no, not further.
Also, Albert, what is the situation in Spain?
But clearly, you are hello. You're pointing out as a key issue, no? Money. Honestly, hospitals and healthcare centers are struggling with budgets and have clear difficulties to do what they have to do, and it's very difficult because you say them, no, in addition to that, you have to do all of this, no? I believe that budget associated to directives and laws it's often forgotten, but I will say that we want to see that in from a different point of view, because at the same time you have to protect also the entity from the impact of having an incident, because the cost of having an incident can be much higher than the cost of protecting you know. It's if you take into account cybersecurity from the beginning, cybersecurity by design, you have to integrate the cost of cybersecurity from the beginning, because if you're not doing that, the cost will be higher and the impact of an incident will be much higher. Of course, a government has to be there to help with budget, and this needs a lot of reflection in order to help the money to arrive directly to institutions. That's clear too.
Thank you so much. I think that now that the NIS directive is under review, these will be some of the comments that will be made, not only from the healthcare sector, but also this will derive from other sectors. But the healthcare sector is an excellent example, because the priority is very, very clear, is to save lives. So when we talk about investing on new equipment, more beds, more hospitals and cybersecurity, it's very clear the distinction and selection that the management board will make. So this is an effort that overall the community tries to make, to change the mindset of those that take decisions. We have almost something less than half an hour left in this wonderful discussion panel. I will move with some of the questions that we have received, but in the meantime, I would like to urge all the experts, all the colleagues that are with us in the YouTube channel, please make pose your questions, because we will not be able to cover them all. So what did the pandemic leave behind, if you can say that it left something behind for your institution? What are the changes in the mindsets that need to be done, and how will the future look like from now onwards? I have received a similar question also from the public chat. So did you need to somehow adjust to the new reality and change the processes and guidelines regarding cybersecurity incidents, regarding preparedness? So what will the future look like on cybersecurity in your hospital and in healthcare overall after this crisis? Sabina.
Okay. So, well, one thing that's changed for sure is on the problem of smart working. Smart working, we did not have so much experience with smart working before. So that is really one big problem, also because of the, the VPNs that the hospital has to open, and what kind of information is going through them. Because sometimes it is difficult. Okay, let's make a distinction between smart working and teleworking. Teleworking, you're responsible for the workstation in the operator's home or wherever he's working from. Smart working, you're doing it from your own computer. So obviously you have to enforce some cybersecurity measures. From the hospital, what we did, we closed the split tunnel between the internet of your computer and the work that you had to do. But that is like a minimal measure. There will have to be some rethinking on the smart working for healthcare. This I believe, because it's here to stay, because there are cost savings. Aside from the bad things, there are also some good things. And the other problem is the telehealth. Okay, for years we've been saying we have to adopt the telehealth platforms, etc. And we hadn't, at least in Italy, done it systematically until now. Now we're doing it for all our chronic patients. So hospitals are looking for the best telehealth platform, because one thing is that you speak with a patient, you do a consultancy. One thing is when you're sending the documents. Many telehealth platforms do not have the secure information sharing systems, because to share, I don't know, a PAX or HL7, it's difficult technically, and not many telehealth platforms have this. And also the third problem is the change fatigue, because when you change your way of working, there is a lot, the cybersecurity goes down, and there's a lot of, the health system is very tired. Consider this in this moment.
So actually the future, what the future will bring is more teleservice that will be supported by the hospital. So it's something like at the next maturity level for the healthcare organizations. Please, Vibeke, I see you wanted to join.
Yeah, I agree with that. The amount of smart working have for sure increased. In Denmark, it has mostly been for office workers who have been used to work at home as well, not in the same degree as we do now, but we have more or less the technology and the infrastructure ready for that. So a lot of people have been able to work at home. The staff at the hospital, the front staff, as we call it, they have worked at their workplaces as they used to do. But what we have seen is for sure that in very high increase of using our digital apps, there's so many more people today who are using what we have an app called Health DK, and it has increased numbers of people who use it, who have downloaded it, and also use it. So the crisis have for sure made it much more normal to use the digital platforms as a citizen. Another aspect, another learning has been that the doctors have started using virtual consulting with their patients. Most house doctors were very quickly on the virtual appointments. So you, instead of me coming up to your doctor, you met with your doctor on the screen. And of course, for a lot of people, it had been a change, but for many citizens, it also had been something which were a relief, because they didn't have to spend so much time with transport and so on to have a talk with their doctor. So and those habits, those practices will probably continue. And we have worked with the telemedication, I don't know what's called in tele. Where you are followed by for telemedicine, yeah. Where work on that on specific areas like lung infections, heart infections, having trouble with your people who have a chronic disease. And those have been pilot projects, but have for sure increased. Now we have a population of citizens who have been used to that way of being a part of the healthcare system, and being also a more responsible part of the healthcare. It's also a matter of empowerment, where you can have where you control your disease much better and your health much better than you do when you had to meet up in the hospitals or at the doctors. And of course, all those aspects have cyber and information security issues as well, which we have to deal with. However, again, we are building on an existing platform, so it helped a bit on that issue. I don't know, Krista, you have something else to?
No, I think you really you come around it very well. So I think also again the awareness of there's a lot of communication about people about the criminals trying to cheat people from their authentication. They have this personal authentication, and there's a lot of warnings out about that. And I think it also creates a lot of awareness that you should be careful with your personal ID, because you use it for your bank or you use it for your health information, right? So I actually think it's a good thing that we get some awareness on that account.
Thank you so much. Martin, Albert?
Well, I would say I would agree with all that other people said, that the working from home, working from remote is becoming normal now. Before the pandemic, it was happening somewhere. For example, when I was a corporate employee, I worked home office like 2 days a week, and it was basically normal. In hospital, I started with this with my employees, and they didn't know how to do it. They didn't want it. Now it's normal. Now everybody knows that they should do it. And the other thing, what I see is that even our business users, meaning medical workers, are now aware that that IT is something that is helping them. It's not regarded directly to the cybersecurity, but to the IT altogether. But at least in my hospital, cybersecurity is part of the IT. And now more of them is taking us as their partners, as someone who is helping them, not the necessary evil they have to deal with. And that's something that helps.
It's a change of mentality that is happening in your hospital. And last but not least, Albert.
But I see that what my colleagues are explaining, we have experienced very similar situations everywhere. While the VPN, remote working, telemedicine, it's happened also here. And I also share the point of view that IT has become a strategic aspect, no, to manage, to cope with this pandemic. And things have been done gone very fast. No, I gave you an example that one application was developed in 2 days, and normally in other situations it would have taken maybe months to develop. So from cybersecurity, we had to adapt also to this situation and to look for solutions and to be, I would say, a bit more flexible, looking for solutions, not only raising risk. And this honestly has been also a very good experience. No, team working and looking for solutions. I have a very good experience, very intense, but very good because we think we have learned a lot, and in the future we will a lot of things will remain. I think we have had a lot of efficiency and also better service for citizens. No, this telemedicine and this rapidity for access the health services, and this has come to remain. I definitely think in that.
Thank you so much. Thank you all for the very valid comments that you made. I'm also taking many notes. I will ask you one final question to somehow bring the European vision in all this discussion. Please, let's try to be brief in our responses because we have only 15 minutes left, and I would like also to have you give one final statement before we close. So at this point, where we are, and with ENISA being here, organizing this event, but not only, what should the European Commission and the European institutions, not only ENISA, maybe other institutions, have a role to play also in this discussion? What would they do all together to support the new reality and to make the new reality happen for the healthcare sector? Don't tell me funds. It's something that I don't have control of, but I know already that you need it.
So what we wish for, no, something that we haven't mentioned here, but it's very important for us now because we are having to enforce the NIS directive. So if it were a little bit more sector specific, it would be of great help. That's my wish.
Thank you so much. Very brief and absolutely to the point. Martin.
Well, I think we all agreed that the awareness of what the cybersecurity is and that it's important is something that needs to be higher. That is something which helps us, everybody, to do our work, because if our colleagues in other departments support us, then we can do it better. And I think there is one more thing which is closely connected to the cybersecurity, and it's IT architecture. Because if you've got good architectured systems, then the cybersecurity is much easier on them. If you are able to get rid of vendor lock-ins and stuff like that, then you can change fast and it will cost you less money. So you will have more money on cybersecurity. So I would I would suggest to also raise awareness about the IT altogether. Cybersecurity now has got some traction in the last year because of the threats, because of the pandemic and threats connected to it, but the rest of IT didn't yet, and I think it's all connected.
Thank you so much. Albert.
Yeah, I believe that as we have talked a lot about NIS directive, that compliance for cybersecurity always has been an opportunity. We have seen with GDPR that all the institutions and organizations really made an effort to comply with this new regulatory framework. But I think that we need the European institutions to see how we can help the healthcare sector with more guidelines, because I sometimes the compliance are too difficult to understand in the specific healthcare sector, and I think we should try to work together to define guidelines to help the people to comply, to make compliance easier. And let me point also one thing a bit more technical, but that could be strategic, because I think that this one single password as a methodology for identification, honestly, it has to start. It has to start disappear, because it's really too weak. Really, we need to do a stronger way of authentication for systems, and initiative at the European level, looking for a robust and an easy solution for identification of citizens. Citizens could not only reduce security risk, but also be a way of integration at the European level. I think that we could look for a way of having a solution at a European level that could be used in all the countries. Just one idea. Okay, thank you very much for.
Thank you so much. Thank you so much, Albert. So, Vibeke?
I would say that, to my experience, the GDPR directive from EU has a huge impact on our approach to both data protection, but also to cyber information security. It had been something which have lifted us up, at least so in Denmark, for sure. I would say that we are still implementing. And we need to have time to implement it well. We are far. I'm quite sure we are far, both in Denmark, but also in other countries. And I think it seems to me that the GDPR had the right level of both having concrete approaches and legislations which have to be fulfilled in each country, but also have the framework for implementing it in different ways according to what you do already, according to your digitalization, according to your culture, and how you the approach to both digitalization and cyber and information security. So it has to be something like that, not more specific or more detailed than we see it right now. Maybe you, Krista, have something to add?
Well, yes, I also think that, creating the platforms for knowledge sharing, supporting us in our work, and supporting everybody who's here and who actually wants to create awareness and spread the news, because it is very important. It has to be, at some point, it has to be a part of everyone's daily routines. So to get that support, I think that's very important that we get that. Yeah, I think also, yeah, I think it's again great. Thanks.
Thank you so much. So I have again a lot of open questions that I would like to further discuss with you, but in the essence of time and because I think more than 2 hours, maybe it's a bit too much for everybody to be focused on. So I would like to thank you all once again for being here and to give you the time to make a closing statement. So what is something that the notion that is mostly important for you that you want people to remember out of this discussion on regarding the cybersecurity situation, hospitals are, healthcare overall crisis? What is the most important note you want to make that everybody will take back home? So I will start the other way around now and ask Albert and Martin to start the discussion. So Albert, the floor is yours.
Thank you very much. Well, I will end at something that you say from ENISA, that cybersecurity is a shared responsibility. And honestly, I think that we have to work together, look for collaboration, and increase the amount of collaboration in order to face this cybersecurity risk that has come to remain. We have to work together and advance trying to build a better and safer world. Thank you very much for the invitation to ENISA. And,
Thank you. Thank you so much. Martin?
Okay. Well, I would say that the one thing I want people to get out of this is that cybersecurity is the same everywhere. Healthcare is special. Healthcare is healing, saving people's lives, and all these good things. But it's not special in the cybersecurity, as the bank can be attacked, the hospital can be attacked, and being a hospital doesn't make the company more secure or anything like that. All the measures that needs to be taken in the bank or in other company needs to be taken in the hospital, regardless of the business we are making. So, and thank you for inviting me here.
Thank you so much, Martin. And I will go now to Sabina.
Well, I wanted to thank, let's say, Europe. The European funding of these projects on cybersecurity has really upgraded our awareness of the problem and also inserted us into a European perspective, which is very, very comforting. This I will say. Thank you very much.
Thank you so much. And I will go first to Krista and then to Vibeke, because I would like Vibeke to have the final word here. Krista, what would you like people to remember out of this session?
Well, I think it's very important that creating this foundation, so working on cyber and information security daily, not just under a pandemic, but making sure that, you know, everything knows what to do, everybody knows what to do, and making sure that you know, also the architecture is solid and the awareness is out there, and try to, you know, prepare for what may come.
And thank you so much, Krista, and saying goodbye to you.
Thank you.
Vibeke, what are your views?
I truly agree with Krista. Preparing, working together before the crisis is fundamental for being able to approach a crisis like we are in right now. And we can only do it together. We can only do it together with our partners in the healthcare sectors and with other cybersecurity agencies. We are not able to do it ourselves. hospital by hospital or region by region or municipality by municipality. It has to be something we do together, and for sure the crisis has been an extra layer of recognition of that approach. So we will have seen both the efforts we have done earlier, how they have had success in the last couple of months, but also what we are going to do more together, because the next crisis we won't be able to. We need to be prepared for that as well. Thank you.
Thank you so much. Very empowering. I think the discussion overall was very insightful and empowering, and it gives us some guidance on how we will move forward. Also from us, from Europe side, we will continue supporting the sector from a policy perspective, from a more technical perspective, to building awareness, building preparedness. And I would like to thank all the panelists for being with me today, and I would like to kindly ask you to join us again. As we discussed already, this was the first occurrence of the eHealth Security Conference. The next one will take place in 1 month's time, so on the 23rd of October, we will be back again here all together discussing the toolbox for COVID-19 tracing mobile applications and the cybersecurity implications this has. We have already a pretty interesting lineup that will be announced soon in the ENISA website. So I would like to thank you all for being here, and we are looking forward to meeting you again in the future. Stay safe and stay cyber secure. Thank you all so much.
Thank you. Thank you.
Thank you. Thank you very much.
Very much.
Thank you.
Bye.
Bye-bye.
Thank you so much.
Bye. Thank you.